The Society of Thoracic Surgeons Adult Cardiac Surgery Database is the world's largest adult cardiac surgery registry, containing over 9 million cardiac surgery procedures. In 2022, a total of 1,010 participants and 3,651 individual surgeons performed a total of 278,202 procedures, of which nearly 78% fell into one of the 9 procedural categories with an established risk model. Isolated coronary artery bypass grafting remains the most performed procedure, comprising 56% of all cases captured in the ACSD in 2022, with a relatively constant average age of 65.6 years and a predicted risk of 30-day mortality of 1.9%. Multiple arterial grafting has increased slightly over the last few years, now occurring in 15.9% of cases. While most procedure volumes have returned to pre-COVID-19 pandemic levels, those involving aortic valve replacement continue to see annual decreases with the increasing penetrance of transcatheter therapy. These changes have resulted in decreases in mean age, 67.3 to 61.9 years. STS predicted risk of mortality, 2.28 to 1.79%, and an increase in bicuspid valve anatomy, 23.9 to 33.1% between 2015 and 2022. Mitral valve surgical volume has been relatively constant, with 12,073 repairs and 10,897 replacements in 2022. Approximately 26% of mitral valve repairs are done through a minimally invasive approach. The influences of transcatheter mitral valve repair and replacement approaches warrant further investigation. An examination of the ACSD shows that in patients with documented atrial fibrillation undergoing first-time, non-emergent open-heart surgery in 2022, the decision to treat atrial fibrillation remains quite low, with only 2.1% undergoing surgical ablation alone, 27.1% undergoing left atrial appendage occlusion alone, and 43.4% undergoing both procedures. Additional risk models were added in 2022, including a multi-valve risk model and a model specific to primary mitral regurgitation. In addition, a new online risk calculator was made available. Ultimately, the STS ACSD is a large source of data that provides high-quality, accurate, and clinically relevant information to participants, regulatory agencies, and most importantly, our patients, ultimately assisting physicians and their patients to make informed decisions.